Oliver Rosenbauer is from the World Health Organization's Global Polio Eradication Initiative.
Well, at the moment, it's probably too soon to say, what the exact progress on virus transmission is. We know that if you have an outbreak of polio, as is the case in Gaza, since it was confirmed in July, it takes at least 2 doses of polio vaccine in order to re-interrupt transmission of the polio vaccine. So our operating assumption is certainly that virus is still transmitting. And of course, today, the second round of a polio vaccination campaign is being launched in Gaza. The first round was implemented early September, from the 1st to the 12th of September. So this is the second round. So the opportunity to deliver a second dose of polio vaccination, and that's the critical part, is how many children will be reached during this campaign. Obviously, if you have gaps in vaccination coverage, if you miss too many children, that will allow the polio virus to continue to survive, to continue to be able to circulate.
And aside from the obvious in terms of doing this in a conflict zone, what are the main challenges your team faces on the ground?
I think the logistical challenges of running a vaccination campaign, an outbreak response campaign, anywhere are formidable. If you want to reach upwards of 500,000 kids with polio vaccine over the course of just over a week, and all the logistical things that go along with that, making sure you've recruited enough vaccinators and community mobilizers, making sure that you have sufficient supply of vaccine, that it's properly maintained, refrigerated, and so forth. It's a big undertaking. And of course, in an area like Gaza, where you have disrupted health services, where you have disrupted electricity services, everything kind of makes that challenge much more difficult. You have a tremendous amount of population movement, so it's very challenging. But what the first campaign in early September showed, which was very successful, is that you have tremendous dedication and tremendous commitment from the local communities, from the local health workers, from the families who came out and brought their children to be vaccinated. So these challenges can be overcome. I think what is underlying all of this, what you absolutely have to have, and what is the overriding challenge in Gaza right now, is you need to have a humanitarian pause in conflict. You need to have that agreed by all parties, and just as importantly, you need to have it respected. And we saw that in early September, and we're seeing it so far today. That is extremely encouraging, and we need that to continue. We need to be very, very clear with that. Without that, the polio campaign will not be successful. It will probably be stopped at that point. You need to give families the assurance that they can come out in safety and security. You need to give the community mobilizers and vaccinators and teams the assurance that they can operate in safety and security.